Assalamu alaikum. Hello guys, I'm Hussein Ali from Group 6. As a biomedical engineer, we were assigned to select, describe and design an assistive technology used in the rehabilitation of respiratory. We found many assistive technology for respiratory rehabilitation, and in the end we chose Incentive Spirometer. We improved design for both 3D model and the circuit using Tinkercad. We're talking about our assistive device. Let me give you a small brief about what is respiratory system and refresh your mind. First, the diagram in the left it shows this is the respiratory system as a whole. The respiratory system is responsible for delivering oxygenated air into the body and removing waste, which is the carbon dioxide, through an enclosed space. The lungs allow gas exchange in a large surface area to ensure that demands of the body are met.
Assalamualaikum and hi, my name is Najwa Afifah and I will explaining about some physiological changes associated with aging. The first one is dilatation of alveoli. Dilatation of alveoli is the condition which alveoli becoming more wider or larger. This happens because of lung tissue is undergo changes with age. Second, enlargement of airspace. Due to the emphysema, the gas exchanging tissue of the lungs are widely distracted and resulting in abnormal large airspace. Third, static elastic recoil of the lung is decreased because of elastin in connective tissue and surface tension of the lung is reduced due to aging. This change will causing a senile emphysema. Due to aging, it will also cause loss of supporting tissue for peripheral airways and decrease in exchange surface area. Next, increase residual volume and functional residual capacity. This happens due to increased static lung compliance combined with the decreased chest wall compliance. Seventh, respiratory muscle strength will decrease, correlate with cardiac index, nutritional status, and hyperinflation. There is also a reduction in the ventilatory response to hypoxia and hypercapnia in perception of increased airway resistance. Lastly, expiratory flow rates decrease with a characteristic alteration in the volume curve. Now, we will continue with pathophysiology associated with respiratory. First, chronic obstructive pulmonary disease, COPD. COPD is a group of diseases that can cause a blockage of airflow and problems related to breathing. Disease in COPD includes emphysema and chronic bronchitis. Emphysema is a lung condition that causes shortness of breath due to alveoli being damaged. Over time, inner walls of air sacs weaken and rupture, and this will creating larger air spaces resulting in reduction of surface area of the lungs and the amount of oxygen that reach your bloodstream. Other than that, chronic bronchitis is an inflammation and irritation of bronchial tubes that carry air to and from air sacs in the lung. Move to restrictive lung disease. It refers to a group of lung disease that prevent the lungs from fully expanding with air due to ventilator-associated lung injury, pleural disorder, and chest wall disease. All of these diseases will reduce the volume of lung, therefore, reduction in the volume of all air-containing components. For bronchial asthma, it is a condition in which airways will narrow and swell that can lead to produce extra mucus. Asthma causes recurring periods of wheezing, chest tightness, shortness of breath, and coughing. Lastly, pulmonary hypertension which it happens when the pressure in the blood vessels leading from heart to lung is too high. Arteries in lungs can narrow, and then blood does not flow properly, resulting in less oxygen in blood.
The pulmonary functioning testing are non-invasive testing which assesses the working condition of the lungs. There is a lot of types for this test. Today we'll be talking about three types for it. First, the spirometry, which uses a spirometer, which is a device that measures the amount of air a patient is able to inhale and exhale. And as we can see in the picture, the patient put a small clip in his nose and a small tube in his mouth. The patient takes a deep breath and blows as hard as possible into the tube. And then the device starts to record the amount of air a patient is able to inhale and exhale. And the second type we have is diffusing capacity tests, which examine the functioning of the alveoli. The person inhales a small amount of carbon monoxide and a tracer gas, which can be a methane or helium, then exhales into a tube as we can see in the picture, where the air is collected and tested. And the last type we have is the lung volume testing, which is a method of measuring the total amount of air in the lungs and how much remains after maximal exhalation. Platysmography measures the changes in volume in different parts of the body, including the lungs. And as we can see in the picture, the patient stands inside an airtight box to do the test. As we can see in the diagram in the left, this is the measurements of the pulmonary function test. It measures the tidal volume, which is the amount of air inhaled or exhaled during normal breathing, minute volume, which is the amount of air exhaled per minute, the vital capacity, total volume of exhaled air after maximal inhalation, functional residual capacity, which is amount of air which remains in the lungs after exhaling normally, residual volume, which is amount of air which remains in the lung after the maximal exhalation. It also measures the total lung capacity, which is the total lung volume when it is filled with as much air as possible. The forced vital capacity, which is amount of air exhaled forcefully and quickly after inhaling as much as one can. Forced expiratory volume, which is amount of air expired during the first to the third seconds of the FVC test. The forced expiratory flow, which is the average flow rate during the middle of the FVC test. And the last measurement is the peak expiratory flow rate, which is the fastest rate of forcing air out of the lung.
Good morning, my name is Divasan. Today I want to talk about respiratory rehabilitations. Now, what we can see as this pulmonary rehabilitation is a supervised medical program that helps people who have lung disease live and breathe better. Respiratory rehabilitations may be recommended to patients with lung conditions such as a chronic obstructive pulmonary disease, which known as a COPD, asthma, pulmonary hypertension, and cystic fibrosis. It also can be recommended before or after surgery for lung transplant or lung cancer. Now we can see for the primary goal of the program is to improve and maintain the maximum level of independence and function. The first we can know is improve our lung function, then to reduce shorten of breaths, third to reduce severity of symptoms, as a four to increase exercise tolerance in order to reduce the impairments. Then we also can know improve our mood and motivation to improve quality of life. Now we can know the respiratory rehabilitation is conducted in an outpatient setting wherein a patient has a regular appointments in a clinic or in a patient residence. However, telerehabilitation and web-based programs have become more widespread. Now the rehabilitation programs are individualized to help design a suitable rehabilitations plan. One of the following tests may be conducted, which is known as a exercise stress test. It can measuring of our oxygen level, blood pressure, and a heart rate while we exercise. Then the breathing test. Breathing test is also check our lungs functioning or not. It can changing your physical activity habits and maximizing your energy level. Then 6 minutes walking test also can measure how far a patient can walk in 6 minutes. Last but not least, the warm-up also can global range of motion exercise and can improve our breathing control. In respiratory rehabilitation, they have some techniques, training, educations, counseling that I know. They have a breathing technique, exercise training, educations, inspiratory muscle training, psychological counseling, nutritional counseling. The first was the breathing techniques. It's pushed lip breathing. It can relax your neck and shoulder muscles. You can breathe in for 2 seconds through your nose, keep your mouth closed. Then you can do yoga breathing with computer aided feedback. You can better control breathing and avoid feeling out of breath. The second, exercise training. Most important component of respiratory rehabilitation reduce the effect of being inactive and the result in lessened shortness of breath. Then the aerobic exercise such as walking and strength training for the arms are common. So everyday living can become more comfortable. By the way, now we can see for the education. Education is the one of the information on how the lungs work and how they effectively take medications. Then we also can learning about the lung disease and we can manage it. Recognition of early flare-ups and how to manage it is have some way to conserve energy. Proper tax education and the importance of smoke cessations. Inspiratory muscle training. Then we know it's to utilize breathing exercise and a device to strengthen muscle involved in breathing. Next, the psychological counseling. As we know, the patient with chronic lung disease may experience depressions, anxiety, and other mental illness. So, it is essential for them to have a support for this area. And the last, for the nutritional counseling, is to ensure the patient is getting the right nutrients in the correct amounts. By the way, for the meal preparation or education and what type of food to eat is taught. And the proper weight management as a being overweight or being too full can interfere with a breathing. Now I want to talk about the incentive spirometer. The spirometers are commonly used at a hospital after surgeries or prolonged illness that lead to extended bed rest. The incentive spirometer is handled medical device used to help the lungs recover after a surgery or lung illness. The device required the patient to inhale at a slow, steady pace to build lung strength and capacity. An incentive spirometer, it can measure the vital capacity. As we know, the vital capacity is the maximal volume of a gas that can be expelled from the lungs after a maximal inhalations. The incentive spirometer is a medical device used in inspiratory muscle training too, and it also prevent pulmonary complications after a surgery. Now I want to explain how to use this incentive spirometer. We should breathe into the device regularly every 1 or 2 hours within 10 to 15 minutes each sessions. First, we have to sit on a chair, either or bed. Then we should hold the incentive spirometer upright with a good. Okay, the label must be facing into your face. You have to see the label. Then we have to exhale fully before you begin to use the spirometer. Then you should place your mouthpiece in mouth and seal lips tightly in the mouthpiece. Okay. Then we should breathe in slowly and deeply as possible. We'll raise the piston in the main chamber. We should try keep the flow indicator in the better or best position to your entire breath. Then you have to hold your breath for at least 5 seconds, so allowing the piston to fall back to zero. Then we should repeat this 10 times in the practice sections. This is how we use the incentive spirometer. As we know, what are the components and the parts are using in the incentive spirometer? First, the tube with mouthpiece, which you have to place your mouth in the mouthpiece. Second, the main chamber. Third, the flow indicator, which measure the maximum or peak speed at which you can blow air out of your lungs. Fourth, the goal marker. And the last, free moving piston. It will rises with each deep breath.
While the incentive spirometer is a simple and straightforward device, there are still limitations to it, such as patients reporting discomfort during their first use, aggressive use leading to lung collapse, and improper breathing technique leading to hyperventilation. With these limitations in mind, our group decided to focus our improvements in terms of helping medical professionals better monitor their patients. And so, our project objectives are as follows. 1. To integrate smart technology with existing device. 2. To improve monitoring of rehabilitation process. And 3. To create a device which can assist in home-based rehabilitation sessions. The goal of our new design is for the data sessions to be recorded, and so our circuits are designed for it to function as a digital spirometer. As stated here, this could help medical professionals in monitoring their patients and their progress, and it's especially catered to telerehabilitation or the current new normal where physical appointments are limited. And so, moving on. Here are pictures of our 3D model. As you can see, not much was modified from the original design of incentive spirometers, as the focus of our project is to add smart technology through the circuits, and the sensor, which would collect the data, would be inside the tube. You can see at the top that there's a QR code here, and through this QR code, if you scan it, you can access the link of our Tinkercad model. Let's now access the 3D model in Tinkercad. If you drag around, you can see the model in any view. Inside the main chamber is the free moving piston, the goal marker, and the handle. On the right, you can see the flow indicator, and below it is the mouthpiece and the breathing tube, where we said that the sensor is within it. Not much has deviated from the original design. As you can see, there's also the numbers indicating the volume. And with that, I'd like to stop and focus on explaining the circuit, which is the focus of our improved design. Here is an image of our circuit in Tinkercad, a quick rundown of our digital spirometer. So this is Arduino Uno, and this is the sensor, which would collect the data, and connected to it is the LCD display, which would display the lung volume. Our circuit's components are limited to the components available in Tinkercad, and like the 3D model, you can access our circuit through this QR code if you scan it. If you access the link, you can actually just press the simulate button for circuit simulation. However, I'd like to better explain our circuit. So the important part of our circuit is the sensor, which would allow the conversion of analog data into digital. And for most digital spirometers, they actually use pressure sensors. However, we only had to use force sensor as it's the sensor available in Tinkercad. And because we can convert force into pressure using calculations, you can see it in our code. the calculation. The value there is actually the area for the mouth tubes. And the following formulas are for the conversion of pressure into lung capacity. And this has been done by the digital spirometer projects, which we cite in our sources. And the last part is just for the LCD display code. So now that that's covered, I'd like to proceed to the simulation of the circuit. You can see that there's a display volume in liters. If you toggle the sensor, it would convert the value there into liters. And this is important since if the data recorded shows improvement in the patient's rehabilitation, they could proceed to the next step in rehabilitation, such as, for example, from low intensity exercises, they could proceed to doing high intensity exercises. So that would mark the end of our presentation. The following slides are just references for our presentation and project. You can see there. Thank you so much for listening.